The Brian Mudd Show is on News Radio 610 WIOD.
Couple things that we've been talking about during the course of the pandemic. Healthcare. Well, yeah, of course, it's about your health. Well, no, actually, one of the big issues has been foregoing ordinary healthcare because we're concerned. We're concerned about going to a hospital in the middle of the pandemic. And if you don't get things like basic checkups, let alone if you have something bigger that needs to be addressed, well, it could certainly be a problem. And we are being joined now by cardiologist Dr. Fahmi Farah. She is cardiologist from Bentley Heart, Fort Worth, in Fort Worth, Texas. And Dr. Farah, thank you for taking the time with us. Tell us a little bit about what you're seeing, and are people still avoiding going to see their doctor?
Hi there. Thank you very much for having me on your show. It's a pleasure to be here. Yes, so, this pandemic it's been going on. We've seen ups and downs and then up. There are certainly a lot of patients in the hospital with COVID-19. And to answer your question, yes, we are seeing a decline in the numbers for other causes other than COVID-19 in the hospitals. More people are dying during the pandemic than just from COVID-19. And according to the American Heart Association, there's an excess of 87,000 deaths during the 2-month window of March and April, with a 22% increase in death due to other causes.
Wow. Well, we know that cardiovascular disease is already the top killer among men. So if we're seeing an increase above and beyond that, is this just letting necessary medical care go, or is it a change in lifestyles? Like, for example, maybe being a bit more sedentary and, not engaging in as much heart-healthy activity?
I think it's a little bit of both. I think certainly the pandemic has placed limitations on people's regular way of living. They're not able to go out to the gyms as much. They're avoiding, going to the grocery stores very often. So they're choosing foods that store longer, which are, not so healthy typically. Also, we know that there's been a huge surge in death due to other causes, particularly cardiovascular disease, especially in states that had highest number of COVID-19. For instance, in New York, there was a 398% rise in heart disease-related deaths during just 2 months of the pandemic, March and April. And we think that one of the key factors is the people are delaying care is to avoid hospitals from fear of COVID-19. For instance, CDC reported at the end of June that the emergency department visits for heart attack declined by 23%. And there was a 20% decline in visits for strokes in the last 5 months of the pandemic. So there's no question that, we believe that there's genuine fear in people, and that's what's keeping them from visiting the hospitals because, they have two primary fears. One is the virus itself, and the other is they're afraid of possibly increasing the burden on the hospitals and healthcare professionals because they know that they're dealing with a lot of COVID patients. But really, people should not delay care for heart attacks, particularly because it is dangerous for two main reasons. Delaying care increases death significantly in the setting of heart attack. And if somebody does survive the heart attack, they can face serious complications down the road with a decreased quality of life. So it is very important to seek care in a timely manner.
Dr. Farah, how does telehealth factor into cardiology? Are you able to do much of what is necessary through telehealth if someone's nervous about coming to a physical location?
Yes, we are seeing a lot of our patients through telehealth in the outpatient setting. So we are still able to provide people access to care for those who are nervous about coming in person. So it's been very helpful, actually, telehealth for patients. So it's preventing the delay in care. So that is definitely a very good avenue for people to still seek care in the outpatient setting. However, when it comes to having a heart attack, that
Sure.
is something that needs to be taken care of in the hospital. And so,
Understood.
That's
Understood. But that's great information all the way around. We sure appreciate you bringing it to us. Again, that is Dr. Fahmi Farah. She's a cardiologist from Bentley Heart in Fort Worth, Texas.